Magandang gabi po sa ating lahat. So, maraming salamat po kay Tita Nenet for inviting me here and to share some disease no, na kailangan nating maging aware, lalo na during this rainy season. So, okay, ang gusto ko pong i-share sa atin is about leptospirosis. So, ano po ba yung leptospirosis? Okay, so yung leptospirosis, okay, is an illness transmitted through mud or water contaminated by the urine or of infected animals. Okay, so how do people get leptospirosis? So, paano po ba tayo nakakakuha ng leptospirosis? So, there are two common ways to get leptospirosis. So, number one is yung exposure natin to the urine or body fluid of the infected animals. Then, number two is drinking, no? Or contact with water or soil that has been contaminated. Okay, so how soon I how soon should I expect the symptoms of leptospirosis? Okay, so symptoms of leptospirosis can develop anytime. So anytime between 2 days to 4 weeks, no, or 1 month after being exposed to the bacteria causing leptospirosis. Okay, so which animals can spread leptospirosis? Okay, so maraming animals na pwedeng makaspread ng leptospirosis such as yung pets like dogs, okay, yung farm animals or wildlife. Pero ang most common na commonly develop or spread leptospirosis includes yung rats, pigs, cattle, dogs, horses, no, sheep, and goats. Okay, so usually ang thinking natin sa daga natin siya nakukuha, pero it can also transmitted by other animals din. Okay, so when and where does leptospirosis occur? So kailan ba usually nag-o-occur yung leptospirosis and saan? So usually leptospirosis is common in tropical country, which is here in the Philippines, and subtropical areas with high rainfall. So sa atin sa Pilipinas, no, since tayo ay tropical, meron din tayong cases dito ng leptospirosis, and usually tumataas yung case ng leptospirosis during the rainfall kapag tag-ulan na. Okay, so yan. How does leptospirosis occur? Okay. So, leptospirosis bacteria, yung bacteria ng leptospirosis, and enter the human body through cuts, or cracks on the skin. So, yung bacteria ng leptospirosis, nag-enter siya through cuts or yung sugat, no, or any crack or gas sa skin, or through membranes of the eyes, nose, or mouth. Okay. So yun yung point of entry ng bacteria. So can I get leptospirosis from a sick household member? Okay, so for example, meron akong leptospirosis, makakahawa ba ako ng ibang tao? So the answer is no. Okay, so leptospirosis is not spread from human to human. So animal to human yung spread niya. So when should I suspect that I have leptospirosis? So okay, you should recommend that you see a doctor immediately if you present with an acute febrile illness at least 2 days. Okay, so kanina, no, tinapik natin is kailan ba mag-occur yung symptoms ng leptospirosis, and ang sagot ay 2 days to 4 weeks, no, or 1 month. So, okay, kapag nagre-reside ka or nakatira ka sa ah, mga lugar na mabahain, or um, naka nag-swimming ka, no, sa water, or nakainom ka ng contaminated water, or merong kang cats, lumusong ka sa ah, baha. Okay, so kailangan mong i-observe, no? So within at least 2 days to 1 week, no, ay 2 to 4 weeks or 1 month, no, kailangan mo i-observe yung at least dalawa, no, sa bagay na ito. So sa mga symptoms na ito. So una yung malagya, so uh, muscle pain. Okay, yung muscle pain, pananakit ng mga muscle. Okay, um, yung red eyes. Okay, yung chills, no, abdominal pain, headache, okay, yellowish discoloration, or decreased amount of urine. Okay, so how is leptospirosis treated? Okay, so paano ba natin natitreat yung leptospirosis? So once your doctor has confirmed that your symptoms are that of leptospirosis, and by doing a test, so kailangan meron mo nang ma-confirm through confirmatory test yung case mo kung leptospirosis talaga yan. So you should be treated with antibiotic. So meron tayong available na antibiotic dito sa Pilipinas, no, to treat leptospirosis. So, treatment is most effective when started as soon as possible. So, mahalaga na kapag na-expose tayo sa bacteria, or sa mga situation na nag-trigger, o uh, na maka ito, situation na nati-trigger yung pag-enter, no, ng bacteria sa katawan natin, like tawag dito, lumusong ka sa baha, no, na meron kang cats, no? So napunta ka sa area na or sa farm. Okay, hindi lang siya kasi nakukuha sa tubig So nakukuha din siya sa mga soil, like farmers, yan. Meron din tayong mga cases na leptospirosis, and then ang work nila is nagtatrabaho sila sa mga bukidin, or magsasaka sila. So okay, kailangan i-observe, no, yung kapag na-expose ka, i-observe mo at least 2 days to 4 weeks, no? Kung meron kang muscle pain, karoon ka ng muscle pain, nag-chill ka, meron kang abdominal pain, okay, so meron kang headache, no? So yun yung kailangan nating maging aware tayo, no, to prevent na yung paglala ng leptospirosis. Okay, so yun nga, natitreat siya, no, sa antibiotic, and then kailangan hindi yun basta-basta naiinom tayo ng antibiotic. Meron tayong confirmatory. That's why we advise na mag-consult tayo sa doctor natin, and then the doctor will confirm, no, yung kumbaga sila yung magda-diagnose, no, kung meron ka talagang leptospirosis. So yan. Do I need to be hospitalized to receive treatment for leptospirosis? Okay, so hindi po. So not all individuals suspected for leptospirosis need hospitalization. Okay, so kung ikaw ay suspected na leptospirosis, ibig sabihin ng suspected, meron ka lang symptoms, no? Pero wala pang test na ginagawa sa iyo, or confirmatory test na nare-receive, no, na leptospirosis talaga yun. So meron ka lang symptoms, no, pero stable yung vital signs mo, meron kang good urine output, hindi ka naninilaw, or wala kang difficulty of breathing, or able ka na makatake ng oral medication. So these things can be managed outpatient settings. Okay, so hindi kailangan na ma-hospitalize. So, on the other hand, no, ikaw, if um, meron ka namang unstable, nagkaroon ka ng unstable vital signs, no, mababa yung blood pressure mo, may jaundice, okay, yung paninilaw ng balat, okay, so merong abdominal pain, merong vomiting, merong diarrhea, okay, yung low urine output, okay, severe headache, or changes in mental alertness, okay, meron kang difficulty of breathing, no? Ito yung mga sign and symptoms na best managed, no, in the hospital uh, setting. Okay, so this clinical decision, ito yung mga clinical decision na made by the physician. So, uh, um, kailangan na-examine ka talaga, and merong confirmatory laboratory result para masabi na meron ka talagang leptospirosis. Okay, so can leptospirosis be prevented? Okay, so mahalaga to. So for those na nakikinig dyan, no, na nasa bahain kayong area, or hindi mo naiiwasan talaga na, I mean, palagi kang nasa farm, no? Or nasa labas, ganyan. So, can leptospirosis be prevented? The answer is yes. Okay, so leptospirosis can be prevented in several ways. Okay, so number one is to avoid contact with animal urine or body fluid ng mga animals. So, okay, especially if there are cuts or abrasions of the skin. Okay, so if alam po natin na meron na tayong sugat, meron na tayong um, parang gasgas, o i-avoid na natin na, for example, madilaan yun ng mga pets natin. So, okay, to prevent, no, leptospirosis. Okay? Okay, number two is wear protective clothing or footwear near soil or water that may be contaminated with animal urine. Okay, so eto, kailangan usually ito yung ginagamit ng bota. Okay, so kung ikaw magsasaka, okay, make sure na nakabota ka, no? Kung ikaw din ay hindi maiwasan na lumusong ka talaga sa baha, no? Magsuot tayo ng ng bota. Okay? Wear protective clothing. Okay? So, next is consume boiled water, especially during the rainy season. So, mahalaga na, for example, kung iinom tayo, di ba, katulad ng sinabi, shinare ko kanina na leptospirosis can be transmitted or spread, okay, by drinking. Okay, tama ba? Two ways. Okay, two ways, no, to get leptospirosis, and nasabi ko dun kanina is by drinking or contact with water or soil that has been contaminated with urine or blood fluid of the infected animals. So to prevent, mag-init po tayo ng mga consume po tayo ng boiled water. Okay. Okay, so yung next is avoid swimming or wading in mudding ponds or slowly moving streams, especially those located near farms or stagnant water. Okay, so ito, avoid natin. So, yun nga, kung hanggat maaari, huwag tayong lulusong sa baha, no? Sa mga mud, yung mga putik, or lalo na sa mga slowing moving stream, yung mga stagnant water. So, i-avoid natin yung mga bagay na to prevent leptospirosis. Okay, so last is control rats and mice around the home on a regular basis. Okay, so ayun. Next is during periods of natural disaster like flood and typhoons, okay, is there any available drugs, okay, drug to take to prevent leptospirosis? So, meron ba tayong available medicine or yon to take to prevent leptospirosis? The answer po is yes. So medication are available to help prevent leptospirosis. However, no, it is still best to consult your physician to identify your risk, no, and to be given proper instructions regarding medication if needed. Okay, so mahalaga po na mag-consult pa rin po tayo sa ating mga doktor. Huwag po tayo basta-basta iinom ng mga antibiotic kasi each antibiotic meron po siyang specific na diseases na tinitreat. So, yun. Are all drugs, okay, for leptospirosis safe for all age group? Okay, so ito yung tanong, lahat po ba ng drugs, no, for leptospirosis is safe for all age group? Okay, so unfortunately, not all not all medications used for leptospirosis prophylaxis and its treatment are safe for all age groups. So hindi po lahat. Okay, like doxycycline, ito po yung ginagamit natin for leptospirosis, and okay, treatment po siya for leptospirosis pero it cannot be given to 8 years old below. Okay, so bawal po siya sa 8 years old below. So can I take doxycycline? Next question. Can I take doxycycline if I am pregnant or breastfeeding? The answer is no. So yung doxycycline, contraindicated siya in pregnant and breastfeeding mothers. Okay, so how can I protect my child from leptospirosis if he cannot take doxycycline? So maganda pong question yun. So paano po ba natin mape-prevent yung mga anak natin na below 8 years old kung hindi po siya pwedeng uminom ng doxycycline? Okay, so best way pa din po, no, to prevent leptospirosis in children is to avoid wading in flood waters. So yun pa rin po talaga yung pinaka best way to do, no, na iwasan po natin na maglaro yung mga bata sa mga flood area or sa mga baha. Okay, so it is also advisable to wear protective clothing and footwear near soil or water that may be contaminated with animal urine. So meron tayong mga available na ngayon na bota na pambata. So pwede natin yun ipasuot sa kanila. Okay, so ano pa rin po ba yung best way, okay, to prevent, no, yung leptospirosis? So ang best way pa din po, last but not the least, best way pa din po na ma-prevent natin yung leptospirosis is environmental sanitation. So okay, so yung declogging ng mga sewage pipes, no, and rivers with rodents control, no, yun po yung mga best way to enhance environmental sanitation. Okay, so yun, garbage accumulate in the flooding areas. Okay, so yun, it will give the animal reserva to get the leptospira, no, and ma-infect sila. Okay, so parang ganito lang po yan. So kung meron tayong mga garbage, no, na na naka-pile lang sa, for example, sa isang lugar, and then nagkaroon ng flood, no, so yun kasi yung nagiging doon din nila nakukuha, no, yung leptospira, no? Yung leptospira, yun po yung bacteria na nakukuha ng mga animals. Yun po yung bacteria ng leptospirosis. Okay, so kapag meron na silang bacteria, okay, yung mga animals, nasa kanila na yun, So, yun naman yung mahahawa nila sa tao. So, best way is magkaroon tayo ng environmental sanitation. So, tanggalin po natin yung mga barado ah, sa mga sewage area natin, ay sewage pipes, no? And sa mga rivers. So, yun po. And, okay. Okay, so I think yun lang po yung um, pinaka frequently asked question when it comes to leptospirosis. And I hope na meron kayong napulot or na-remind tayo, no, naging aware tayo to um, na ay ito pala yung leptospirosis and we need to prevent it. So, yun lang po. Thank you and God bless po.